Welcome. Have you ever heard of a disease that can affect almost any part of your body, from your eyes and mouth to your brain? We're diving deep into Behçet's disease, a rare and complex disorder that can present a unique set of challenges. Get ready to explore its causes, symptoms, diagnosis, and treatment options. The exact cause of Behçet's disease remains a mystery, but it's believed to be an autoimmune disorder. This means the body's immune system mistakenly attacks its own healthy tissues. Genetic factors play a significant role, with certain genes increasing the risk of developing the disease. Environmental triggers, such as viral or bacterial infections, are also thought to contribute to the onset of Behçet's in genetically susceptible individuals. It's a complex interplay of factors that scientists are still working to unravel. In Behçet's disease, inflammation is the key player. The immune system's attack primarily targets blood vessels, leading to vasculitis, or inflammation of the blood vessels. This inflammation can occur in vessels of all sizes and in various organs, leading to the diverse range of symptoms seen in the disease. The inflammation causes damage to the vessel walls, disrupting blood flow and potentially leading to ulceration, clotting, and even aneurysms. This widespread vascular inflammation is what distinguishes Behçet's from other autoimmune conditions. Behçet's disease is a rare condition, with prevalence varying significantly across the globe. It's most common along the ancient Silk Road, affecting populations in Turkey, Iran, Japan, and the Mediterranean region. The prevalence is lower in North America and Northern Europe. While it can affect people of all ages, it typically manifests between the ages of 20 and 40. Both men and women can develop Behçet's, but the disease tends to be more severe in men. The symptoms of Behçet's disease are incredibly diverse and can vary greatly from person to person. Recurrent oral ulcers, similar to canker sores, are a hallmark of the disease. These ulcers are often painful and can occur frequently. Genital ulcers, which are also painful, are another common symptom. Eye involvement is significant, with uveitis, or inflammation of the eye, potentially leading to vision loss if left untreated. Skin lesions, such as like bumps, nodules, or rashes, are also frequently observed. Joint pain and arthritis, neurological symptoms like headaches, seizures, or cognitive dysfunction, and gastrointestinal issues are further potential manifestations of Behçet's disease. The unpredictable nature of these symptoms makes diagnosis challenging. Diagnosing Behçet's disease can be complex due to the lack of a single definitive test. Diagnosis is primarily based on clinical criteria, meaning doctors evaluate the patient's symptoms and medical history according to established guidelines. The International Study Group criteria for Behçet's disease are often used, requiring the presence of recurrent oral ulceration plus at least 2 of the following: recurrent genital ulceration, eye inflammation, uveitis, skin lesions, or a positive pathogy test. The pathogy test involves pricking the skin with a sterile needle and observing for the formation of a small bump or pustule within 24 to 48 hours, indicating an exaggerated inflammatory response. Blood tests can help rule out other conditions and assess for inflammation, but they are not specific for Behçet's. While there aren't distinct classifications or types in the traditional sense, Behçet's disease can be categorized based on the predominant organ systems affected. For instance, some patients might primarily experience mucocutaneous involvement with mainly oral and genital ulcers, while others might have more severe ocular or neurological involvement. This distinction is important for tailoring treatment strategies to address the specific needs of each individual. There is no cure for Behçet's disease, but treatment focuses on managing symptoms and preventing complications. Medications aim to reduce inflammation and suppress the immune system. Corticosteroids are often used to quickly reduce inflammation during flares. Immunosuppressants, such as azathioprine, cyclosporine, and methotrexate, can help control the disease long-term. Biologic therapies like TNF inhibitors and IL-1 inhibitors are increasingly used for patients who don't respond well to conventional treatments. Topical creams and mouthwashes can alleviate pain from ulcers. Regular eye exams are crucial to monitor for uveitis and prevent vision loss. The treatment plan is highly individualized and adjusted based on the severity of the disease and the organs involved. Currently, there are no specific ways to prevent Behçet's disease due to the unclear etiology. Since genetic predisposition plays a role, avoiding environmental triggers that might activate the immune system could potentially be helpful, but this is difficult to achieve in practice. Maintaining a healthy lifestyle, managing stress, and avoiding smoking may contribute to overall well-being and potentially reduce the severity of symptoms in those who are already diagnosed. However, these measures are not proven to prevent the onset of the disease. The prognosis of Behçet's disease varies depending on the severity of the disease and the organs affected. Some individuals experience mild symptoms with infrequent flares, while others have more severe and chronic disease. Eye involvement and neurological complications can significantly impact quality of life and long-term outcomes. With appropriate treatment and management, many individuals with Behçet's disease can lead relatively normal lives. Recent research is focused on identifying specific genes and immune pathways involved in the disease pathogenesis. Clinical trials are evaluating new therapies, including targeted biologic agents, with the goal of improving treatment efficacy and reducing side effects. The future holds promise for more personalized and effective approaches to managing Behçet's disease.